Question 1. A correctional healthcare professional is reviewing an inmate's health assessment during intake. The inmate has a history of hypertension and is currently on medication. The healthcare professional notices that the inmate's blood pressure is elevated during the intake screening. Which of the following should be the primary course of action for the healthcare professional? A. Document the blood pressure reading and proceed with the intake process, scheduling follow-up in 1 month. B. Order immediate emergency treatment, including intravenous medication for hypertension. C. Adjust the inmate's current medication regimen without consulting physician. D. Perform further assessment and notify the supervising physician to determine the next steps for managing the hypertension. Answer: D. Perform further assessment and notify the supervising physician to determine the next steps for managing the hypertension. Explanation: the healthcare professional should first assess the situation and consult the supervising physician before adjusting any medications or administering any treatments. The elevated blood pressure could be indicative of an underlying issue such as poor medication adherence, stress, or a more serious medical condition. The healthcare professional is to provide a comprehensive assessment, including documenting the vital signs and coordinating with the medical team to determine the appropriate intervention. Immediate emergency treatment is unnecessary unless there is a hypertensive crisis which requires specific criteria. Without consulting a physician, adjusting the medication regimen could lead to adverse effects or complications. Proper documentation and coordination with the physician are crucial for patient safety and proper care. Question 2. Which of the following statements best represents an ethical challenge in correctional healthcare when dealing with inmates diagnosed with substance use disorders? A. Inmates with substance use disorders should receive the same healthcare services as the general population, regardless of their criminal charges. B. Correctional health professionals should prioritize treatment for substance use disorders over other medical conditions, regardless of the severity of the other conditions. C. Correctional health professionals must respect inmates' autonomy while offering substance use disorder treatments, ensuring informed consent obtained. D. Correctional health professionals are not legally required to provide any substance use treatment unless mandated by court order. Answer: C. Correctional health professionals must respect inmates' autonomy while offering substance use disorder treatments, ensuring informed consent is obtained. Explanation: one of the significant ethical challenges when dealing with inmates diagnosed with substance use disorders is respecting their autonomy while ensuring they are informed about their treatment options. Ethical standards in correctional healthcare, as guided by HIPAA regulations and medical ethics, require healthcare providers to offer treatment in a manner that respects the individual's right to make informed decisions. Inmates must understand the implications of treatments and be given the opportunity to consent or refuse treatment. While inmates should receive healthcare services, prioritizing substance use disorder treatment over other medical conditions can be inappropriate, especially in cases involving severe medical conditions that may require urgent attention. Correctional healthcare professionals are not always mandated by court order unless it involves court order. Drug rehabilitation. Question 3. Scenario-based. Mr. Andrews, an inmate with a history of diabetes and hypertension, is currently being managed by the correctional health staff. During a routine health screening, the healthcare professional notices that Mr. Andrews is exhibiting signs of hypoglycemia, shakiness, sweating, and confusion. The healthcare professional is aware that Mr. Andrews' blood sugar level has not been properly monitored in the past 24 hours. Limited resources. Given this scenario, what should be the healthcare professional's next step? A. Immediately administer glucose and continue monitoring, documenting the symptoms, and alert the physician for further instructions. B. Order full blood panel for diabetes and hypertension management without administering any immediate treatment. C. Report the incident to the security personnel as behavioral issue and take no immediate medical action. D. Perform physical examination for other causes of symptoms such as psychological distress and delay glucose administration until further assessment. Answer: A. Immediately administer glucose and continue monitoring, documenting the symptoms, and alert the physician for further instructions. Explanation: in this scenario, the healthcare professional must prioritize immediate action to stabilize Mr. Andrews' condition. Hypoglycemia can be life-threatening if not addressed promptly. Administering glucose is necessary to raise the blood sugar level, and further monitoring and documentation will help to assess the effectiveness of the intervention. The healthcare professional should alert the supervising physician to ensure appropriate long-term management and adjust the care plan, especially regarding glucose monitoring. While ordering full blood panel or performing physical examination may be important in the long term, immediate glucose administration takes precedence when hypoglycemia is suspected. Ignoring the medical condition by reporting it as behavioral issue or intervention could lead to severe complications, and this would not be an appropriate response in correctional healthcare. Question 4. An inmate in a correctional facility presents with a history of substance use disorder and is undergoing detoxification. The healthcare professional notices that the inmate is displaying symptoms of withdrawal, such as tremors, anxiety, nausea, and confusion. Given the seriousness of withdrawal symptoms and the risk of severe complications, what is the best approach for managing this inmate's condition? A. Immediately start the inmate on detox protocol using benzodiazepines and other medications as deemed necessary by supervising physician. B. Offer hydration and general support and wait for the symptoms to resolve without administering any medications. C. Send the inmate to an external medical facility for detoxification, as correctional facilities are not equipped to handle withdrawal. D. Restrict the inmate's physical activity and regular monitoring, but take no immediate action until the symptoms escalate further. Answer A. Immediately start the inmate on a detox protocol using benzodiazepines and other medications as deemed necessary by a supervising physician. Explanation. When dealing with inmates undergoing substance withdrawal, healthcare professionals must recognize the potential severity of the symptoms and act quickly to prevent complications such as seizures, delirium, and even death. Immediate treatment, typically involving the use of benzodiazepine. Other medications based on the specific substance the inmate was addicted to is critical. This treatment helps to manage withdrawal symptoms and prevent complications. Simply offering hydration or waiting for symptoms to worsen could lead to the inmate experiencing life-threatening complications. Sending the inmate to an external medical facility may be necessary in certain severe cases, but correctional facilities are typically equipped to handle detoxification protocols under the guidance of healthcare professionals. Restricting physical activity alone without addressing the withdrawal symptoms would not be sufficient for proper care. Question 5. In a correctional healthcare setting, you are tasked with providing health education to inmates regarding HIV prevention. Which of the following strategies would be most effective in addressing the health needs of the inmates and promoting long-term behavioral change in a correctional environment? A. Conduct group sessions that focus solely on the physical symptoms of HIV and its transmission without addressing the social and behavioral aspects. B. Distribute printed materials on HIV prevention and leave them available in common areas for inmates to access voluntarily. C. Provide individualized counseling sessions, including risk assessments and strategies for safer behaviors alongside educational materials tailored to inmate-specific needs. D. Only provide information about HIV prevention to inmates who request it, as mandatory education could be seen as intrusive. Answer C. Provide individualized counseling sessions, including risk assessments and strategies for safer behaviors, alongside educational materials tailored to inmate-specific needs. Explanation. The most effective approach to health education in correctional setting requires combination of individualized counseling and tailored educational materials. HIV prevention education should be context-specific, addressing not only the physical aspects of the disease and its transmission, but also behavioral factors, risk assessments, and tailored strategies for behavior modification. Group sessions are valuable but may not address the individual needs of each inmate. Simply distributing printed materials does not ensure that inmates will engage with the content or fully comprehend it. Individualized counseling, which includes risk assessments and specific prevention strategies, addresses both the psychological and physical factors that contribute to high-risk behavior, making it the most effective approach for promoting long-term behavioral change. Question 6. During an intake assessment, an inmate reports a history of chronic asthma. The healthcare professional assesses the inmate's current condition, which is stable, but it's important to determine the best course of action for managing this condition in the correctional facility. What should the healthcare professional do next to ensure proper care for the inmate with asthma? A. Schedule follow-up appointment in 30 days, with no further action needed until the next assessment. B. Provide the inmate with written asthma action plan and ensure the inmate has access to their prescribed inhaler and any necessary medications. C. Disregard the history of asthma if the inmate is not currently showing symptoms and focus on other aspects of their intake assessment. D. Administer routine asthma medication immediately without assessing whether inmate is experiencing an asthma exacerbation. Answer: B. Provide the inmate with a written asthma action plan and ensure the inmate has access to their prescribed inhaler and any necessary medications. Explanation: asthma is a chronic condition that requires proper management to prevent acute exacerbations, especially in a correctional facility environment where stress and environmental factors may trigger asthma symptoms. The healthcare professional should provide the inmate with an asthma action plan, which includes instructions for managing their asthma and recognizing signs of exacerbation. Ensuring access to prescribed inhalers and other necessary medications is crucial to help the inmate manage their condition and prevent future complications. A follow-up appointment in 30 days may be useful, but immediate action should be taken to ensure that the inmate's asthma is properly managed on a daily basis. Disregarding the history of asthma or administering medications with proper assessment could lead to unnecessary risks and complications. Question 7. Inmates in a correctional facility may be at high risk for contracting tuberculosis (TB) due to overcrowding and limited access to healthcare. During a routine screening, an inmate presents with a persistent cough and night sweats. What is the healthcare professional's immediate response to this scenario? A. Recommend that the inmate rest in their cell and continue regular monitoring for any changes in symptoms. B. Begin isolation procedures immediately. Arrange for a chest X-ray and send a sputum sample for TB testing. C. Administer antibiotics to the inmate for presumed bacterial pneumonia without further diagnostic testing. D. Notify the security staff of potential disruptive behavior as the inmate may be malingering. Void work. D. Answer: B. Begin isolation procedures immediately. Arrange for a chest X-ray and send a sputum sample for TB testing. Explanation: the symptoms presented, persistent cough and night sweats, are indicative of potential tuberculosis, and immediate steps should be taken to diagnose and prevent the spread of TB. The first course of action is to begin isolation procedures to prevent transmission to other inmates and healthcare staff, followed by obtaining diagnostic tests such as chest X-ray and sputum sample for TB testing. TB is serious communicable disease that requires prompt diagnosis and treatment to reduce the risk of outbreaks. Administering antibiotics for presumed pneumonia without confirming the diagnosis could be ineffective and delay proper treatment. It is also essential to avoid attributing the symptoms to malingering, as doing so could prevent timely intervention and risk the health of other individuals in the facility. Question 8. In the correctional healthcare environment, confidentiality is of utmost importance when handling patient information. A correctional health professional has access to an inmate's medical record and notices that another staff member is casually discussing the inmate's health history with colleagues in the break room. What should the healthcare professional do in this situation? A. Ignore the conversation, as it may be harmless and does not affect the inmate's immediate care. B. Inform the colleague that discussing an inmate's health history in public space is a violation of privacy laws and report the incident to the supervisor. C. Ask the colleague to stop talking about the inmate's health in front of others, but do not escalate the situation further. D. Encourage the staff member to continue the conversation as long as the inmate not being disclosed to the general public. Answer: B. Inform the colleague that discussing an inmate's health history in public space is violation of privacy laws and report the incident to supervisor. Explanation: confidentiality in healthcare settings, particularly in correctional facilities, is governed by strict laws such as the Health Insurance Portability and Accountability Act (HIPAA). Under HIPAA, medical information about inmates must be protected and disclosed only in appropriate, confidential settings. The healthcare professional has an ethical and legal responsibility to report any breaches of confidentiality. Informing the colleague of the violation and reporting the incident to supervisor ensures that corrective actions can be taken to prevent further breaches and maintain the integrity of the healthcare system. Simply asking the colleague to stop talking is not sufficient, as the issue must be addressed within the organization to prevent future occurrences. Question 9. A correctional healthcare provider is preparing to administer a new medication to an inmate. The medication has been prescribed by the physician, but the healthcare provider is concerned about potential side effects and drug interactions. What is the best course of action to ensure safe medication administration? A. Administer the medication as prescribed and monitor the inmate for any side effects. B. Withhold the medication until further consultation with the prescribing physician can be obtained to address concerns about side effects. C. Modify the prescribed medication based on the healthcare provider's knowledge of the inmate's medical history. D. Administer the medication without any further consideration, as the physician's prescription is the final authority. Answer: B. Withhold the medication until further consultation with the prescribing physician can be obtained to address concerns about side effects. Explanation: when administering medication in a correctional healthcare setting, the healthcare provider must be vigilant about potential drug interactions and side effects. If there are concerns about the safety of the prescribed medication, it is essential to consult with the prescribing physician before proceeding. Withhold medication temporarily while clarifying concerns ensures patient safety. Modifying the prescribed medication without physician approval or administering it without addressing potential side effects could lead to serious health risks. It is critical to follow established protocols and maintain open communication with the prescribing physician to ensure the inmate receives the safest possible treatment. Question 10. In a correctional healthcare setting, an inmate with a history of diabetes presents with signs of hypoglycemia, including increased thirst, frequent urination, and fatigue. The inmate has not been adhering to their prescribed diet and has been consuming high-sugar foods. What should the healthcare professional do to address the situation? A. Reassure the inmate that these symptoms are normal and do not require immediate intervention. B. Administer insulin without further assessment and monitor the inmate's blood sugar levels. C. Perform thorough assessment, including checking the inmate's blood sugar levels and addressing non-compliance with the prescribed diet. D. Recommend that the inmate increase physical activity to help lower blood sugar levels without further intervention. Answer: C. Perform a thorough assessment, including checking the inmate's blood sugar levels and addressing non-compliance with the prescribed diet. Explanation: symptoms of hypoglycemia in diabetic patient require thorough assessment. The healthcare professional should check the inmate's blood sugar levels and, based on the results, determine the appropriate course of action. Additionally, non-compliance with prescribed dietary restrictions is a critical factor that must be addressed. Providing education on the importance of diet in managing diabetes and offering support for adherence to the treatment plan is essential for long-term control of the condition. Administering insulin without assessing the current blood sugar level could lead to incorrect dosing. Simply recommending increased physical activity is not sufficient to address acute hypoglycemia. Question 11. An inmate who has been diagnosed with hepatitis C is being considered for treatment with direct-acting antiviral (DA) medications. The healthcare provider is aware that these medications can have potential side effects, including liver toxicity. What steps should the healthcare provider take before starting treatment? A. Immediately initiate the treatment regimen as prescribed without further assessment. B. Perform baseline liver function tests and assess for potential contraindications before starting treatment. C. Delay treatment until the inmate shows more severe symptoms of hepatitis C. D. Offer supportive care and monitoring without initiating any antiviral treatment. Answer: B. Perform baseline liver function tests and assess for potential contraindications before starting treatment. Explanation: before initiating treatment with direct-acting antivirals for hepatitis C, it is essential to perform baseline liver function tests and assess for potential contraindications. Hepatitis C treatment can affect liver function, and understanding the inmate's baseline health status allows for better monitoring of potential effects. Failing to assess liver function or delay treatment until symptoms worsen could lead to unnecessary complications. Offering supportive care without antiviral treatment would not address the underlying hepatitis C infection, which could progress to more severe liver damage if untreated. Question 12. An inmate is exhibiting signs of severe mental distress, including agitation, paranoia, and delusions. The healthcare professional suspects that the inmate may be experiencing an acute psychiatric episode. What is the best immediate course of action? A. Restrain the inmate immediately and administer sedatives without consulting a psychiatrist. B. Perform a thorough psychiatric assessment, provide a safe environment, and involve a psychiatrist for further evaluation and treatment. C. Ignore the symptoms and monitor the inmate for any changes, as the symptoms are likely temporary. D. Administer pain relief medications to calm the inmate and address any physical discomfort. Answer: B. Perform a thorough psychiatric assessment, provide a safe environment, and involve a psychiatrist for further evaluation and treatment. Explanation: Inmates experiencing acute psychiatric episodes such as agitation, paranoia, and delusions require a comprehensive psychiatric assessment to determine the cause and appropriate treatment. Creating a safe environment for the inmate, ensuring they do not harm themselves or others, is critical. Involving a psychiatrist or mental health professional for further evaluation ensures that the inmate receives the necessary care, which may include medications, therapy, or a change in their treatment plan. Restraining the inmate without addressing the underlying psychiatric cause or simply administering sedatives could exacerbate the situation and is not the most effective response. Question 13. An inmate who has been diagnosed with tuberculosis (TB) is undergoing treatment with an anti-tuberculosis regimen. The healthcare provider is concerned about the potential for drug resistance. What steps can be taken to minimize the risk of drug-resistant TB in this inmate? A. Ensure the inmate completes the full course of treatment under direct observation as part of a directly observed therapy program. B. Allow the inmate to take medications independently as long as they report feeling better. C. Decrease the medication dose once the inmate shows signs of improvement to avoid side effects. D. Only monitor the inmate's progress periodically, assuming that the TB will resolve on its own without intervention. Correct answer: A. Ensure the inmate completes the full course of treatment under direct observation as part of a directly observed therapy program. Explanation: directly observed therapy is the gold standard for TB treatment, especially in correctional facilities. It involves healthcare professionals observing the inmate taking their medication to ensure full compliance with the prescribed regimen. This approach is crucial for minimizing the risk. Drug-resistant TB, as incomplete or inconsistent treatment, can lead to the development of resistant strains. Allowing inmates to take medications independently or reducing medication doses prematurely could result in inadequate treatment and the emergence of drug-resistant TB. Periodic monitoring without direct observation may not ensure treatment adherence, and the inmate's condition may worsen. Question 14. A correctional healthcare professional is tasked with evaluating an inmate who presents with unexplained weight loss, fatigue, and joint pain. The inmate has a history of intravenous drug use and reports occasional fever. What is the most likely diagnosis and what initial tests should be performed? A. The inmate is likely experiencing a viral infection unrelated to their drug use and testing for influenza should be performed. B. The inmate's symptoms are likely caused by bacterial infection and blood cultures should be obtained immediately. C. The inmate may have chronic infections such as HIV or hepatitis, and HIV and hepatitis screenings along with complete blood count (CBC) should be performed. D. The symptoms unrelated to the inmate's drug use and should be monitored for any further changes. Answer: C. The inmate may have a chronic infection such as HIV or hepatitis, and HIV and the hepatitis screenings along with a complete blood count (CBC) should be performed. Explanation: given the inmate's history of intravenous drug use, the most likely diagnosis involves a chronic infection such as HIV or hepatitis, both of which can present with symptoms like unexplained weight loss, fatigue, joint pain, and fever. Initial testing should include screenings for HIV, hepatitis, and AEO assess for any underlying infections or immune system compromise. Prompt identification of these conditions is crucial for appropriate treatment and to prevent transmission to others in the correctional facility. While bacterial infections can also cause similar symptoms, the history of drug use makes HIV and hepatitis a higher priority for initial screening. Question 15. An inmate presents with symptoms of a severe allergic reaction after being exposed to an insect bite. The inmate exhibits swelling, difficulty breathing, and hives. What should the healthcare professional do to address this life-threatening situation? They administer an antihistamine and monitor the inmate for improvement without further intervention. B. Administer an epinephrine injection immediately and ensure the inmate is monitored closely in a medical unit. C. Recommend that the inmate rest and avoid any further exposure to insects, as the symptoms should resolve on their own. D. Apply cold compressors to the affected areas and advise the inmate to take over-the-counter antihistamines. Answer: B. Administer an epinephrine injection immediately and ensure the inmate is monitored closely in a medical unit. Explanation: severe allergic reactions, such as anaphylaxis, require immediate intervention with epinephrine to reverse the life-threatening symptoms, including difficulty breathing and swelling. Administering epinephrine promptly can save the inmate's life and prevent the condition from worsening. The inmate should be monitored in a medical unit. Ensure their condition stabilizes. Antihistamines alone are not effective in treating severe allergic reactions like anaphylaxis. Rest and avoiding further insect exposure are important for future prevention, but immediate action to treat the current symptoms is necessary. Question 16. A healthcare provider is evaluating an inmate with a history of hypertension who is not currently on medication for blood pressure control. The inmate has a family history of cardiovascular disease and is exhibiting signs of high blood pressure. What should the healthcare provider do first? A. Prescribe antihypertensive medications and monitor the inmate's response. B. Recommend lifestyle changes such as diet and exercise without initiating medication. C. Perform full cardiovascular assessment, including blood pressure measurements over time, and consider starting medication if necessary. D. Advise the inmate to return for follow-up visit in 30 days to reassess their condition. Answer C. Perform a full cardiovascular assessment, including blood pressure measurements over time, and consider starting medication if necessary. Explanation. Before prescribing antihypertensive medications, the healthcare provider should perform a comprehensive cardiovascular assessment, which includes obtaining multiple blood pressure measurements over time to confirm a diagnosis of hypertension. Given the family history of cardiovascular disease, essential to assess the inmate's overall risk and determine the best course of treatment. Initiating medication without thorough evaluation could lead to inappropriate treatment. Lifestyle modifications, including changes to diet and exercise, are important but may not be sufficient on their own for managing hypertension in the long term. Question 17. A correctional healthcare provider is managing a patient who is at risk for opioid overdose due to their history of opioid addiction. The inmate presents with a decreased level of consciousness and respiratory depression. What is the first step in managing this potentially life-threatening condition? A. Immediately administer naloxone, Narcan, and prepare for further resuscitation if necessary. B. Wait to see if the inmate's condition improves on its own before taking any action. C. Administer opioid medications to counteract the effects of the overdose. D. Restrict the inmate's access to opioids and observe their condition without any immediate medical intervention. Answer A. Immediately administer naloxone, Narcan, and prepare for further resuscitation if necessary. Explanation. In cases of opioid overdose, naloxone, Narcan is the life-saving medication that should be administered immediately to reverse the effects of the overdose, including respiratory depression. Prompt administration of naloxone can rapidly restore normal breathing and consciousness, reducing the risk of death or permanent damage. Waiting for the condition to improve without intervention can lead to severe complications. Administering additional opioid medications or restricting access without addressing the overdose is not effective in treating the acute situation. Question 18. An inmate presents with a history of chronic pain following a serious injury. The inmate requests prescription pain medication but has a history of substance abuse. The healthcare provider is concerned about the potential for misuse and dependency. What is the best approach to managing this inmate's pain? A. Prescribe opioid pain medications and monitor the inmate's use carefully. B. Deny the inmate's request for pain medication and suggest alternative treatments without further discussion. C. Conduct thorough pain assessment. Discuss alternative pain management strategies and offer comprehensive treatment plan that may include non-opioid medications. D. Offer the inmate only over-the-counter pain medications, regardless of the severity of condition. Answer C. Conduct a thorough pain assessment, discuss alternative pain management strategies, and offer a comprehensive treatment plan that may include non-opioid medications. Explanation. Given the inmate's history of substance abuse, it is crucial to approach pain management carefully to avoid the risk of dependency or misuse. Conducting a thorough pain assessment helps to understand the nature and severity of the pain, which is necessary for developing an appropriate treatment plan. Offering alternative pain management strategies, including non-opioid medications, physical therapy, and psychological support, can help manage chronic pain without resorting to potentially addictive medications. Prescribing opioids without careful consideration or offering only over-the-counter medications may not effectively manage the inmate's pain and could lead to complications. Question 19. An inmate presents with a complaint of chest pain. The healthcare provider suspects a cardiac issue but is unsure whether the pain is related to a serious heart condition or is musculoskeletal in nature. What is the best course of action for the healthcare provider to take? A. Assume that the pain is musculoskeletal and advise the inmate to rest. B. Conduct an immediate electrocardiogram and blood tests to assess for cardiac issues and prepare for further evaluation based on the results. C. Recommend the inmate take over-the-counter pain medication and monitor for any changes in symptoms. D. Send the inmate back to their cell and advise them to rest, suggesting that the pain is not related to a condition. Answer B. Conduct an immediate electrocardiogrammic and blood test to assess for cardiac issues and prepare for further evaluation based on the results. Explanation: chest pain is a potentially life-threatening symptom that requires immediate evaluation to rule out serious cardiac issues such as a heart attack. Conducting an ECG and blood tests, such as troponin levels, allows the healthcare provider to assess for cardiac causes of the pain. Make an informed decision about further treatment. Simply assuming the pain is musculoskeletal or recommending rest without proper diagnostic testing could lead to a misdiagnosis and serious health consequences. Monitoring without intervention is also not appropriate for symptoms that may indicate a cardiac emergency. Question 20. A correctional healthcare provider is monitoring an inmate with chronic obstructive pulmonary disease (COPD). The inmate reports an increase in shortness of breath and cough, which has worsened over the past 24 hours. What is the best course of action for the healthcare provider to take? A. Prescribe a new inhaler and advise the inmate to rest in their cell. B. Assess the inmate's symptoms, perform a respiratory exam, and provide supplemental oxygen if necessary, considering the possibility of an acute exacerbation of COPD. C. Ignore the symptoms and wait for the inmate to report any further issues. D. Recommend that the inmate stop smoking and monitor their symptoms without further intervention. Answer B. Assess the inmate's symptoms, perform a respiratory exam, and provide supplemental oxygen if necessary, considering the possibility of an acute exacerbation of COPD. Explanation: an acute exacerbation of COPD is a serious condition that requires immediate intervention. The healthcare provider should assess the inmate's symptoms, including conducting respiratory exam, and provide supplemental oxygen as needed. Acute exacerbations of COPD require prompt treatment with bronchodilators, steroids, or antibiotics if there is evidence of an infection. Simply prescribing new inhaler without assessing the current symptoms or waiting for further issues could lead to worsening of the condition and increased risk of respiratory failure. Smoking cessation is important for long-term management but does not address the immediate exacerbation. Question 21. A correctional healthcare professional is managing a patient who presents with severe lower abdominal pain, nausea, and vomiting. The patient has a history of chronic constipation and opioid use. What is the most likely diagnosis and what should the healthcare provider do first? A. The patient is likely experiencing a gastric ulcer and the healthcare provider should administer proton pump inhibitors immediately. B. The patient is likely experiencing opioid-induced constipation and the healthcare provider should assess for bowel obstruction and administer appropriate laxatives or stool softeners. C. The patient is likely experiencing an acute appendicitis and the healthcare provider should perform an abdominal ultrasound and prepare possible surgery. D. The patient is likely experiencing a urinary tract infection and the healthcare provider should administer antibiotics and perform a urine culture. Answer B. The patient is likely experiencing opioid-induced constipation and the healthcare provider should assess for bowel obstruction and administer appropriate laxatives or stool softeners. Explanation: opioid use can lead to constipation and, in severe cases, opioid-induced bowel dysfunction, which can result in symptoms such as abdominal pain, nausea, and vomiting. The healthcare provider should first assess the patient's bowel function to rule bowel obstruction and determine the need for laxatives or stool softeners. An abdominal ultrasound may be necessary if there are concerns about other conditions, such as appendicitis, but opioid-induced constipation is the most likely cause given the patient's history. Administering proton pump inhibitors or antibiotics is not appropriate without confirming the diagnosis. Question 22. An inmate with a known history of schizophrenia is brought into the healthcare unit after exhibiting aggressive behavior. The inmate is not currently on any antipsychotic medication and refuses treatment. What should the healthcare provider do next? A. Administer antipsychotic medication to sedate the inmate, regardless of their refusal. B. Attempt to de-escalate the situation using verbal techniques and assess for any imminent danger to self or others before considering medication. C. Restrain the inmate immediately to prevent further aggression. D. Send the inmate back to their cell to calm down and avoid intervention until the behavior escalates. Answer B. Attempt to de-escalate the situation using verbal techniques and assess for any imminent danger to self or others before considering medication. Explanation: when dealing with an inmate who has a history of schizophrenia and is exhibiting aggressive behavior, the healthcare provider should first attempt to de-escalate the situation using verbal techniques, assessing the situation to determine if the inmate poses an imminent danger to themselves or others. Critical, if the inmate refuses treatment, forcibly administering antipsychotics or restraining the individual should be avoided unless absolutely necessary. Restraints and medication should only be used if the individual is a danger to themselves or others. Following a thorough evaluation. Question 23. An inmate is receiving treatment for a severe skin infection that has not improved with oral antibiotics. The healthcare provider is concerned that the infection may be caused by a resistant strain of bacteria. What is the next step the healthcare provider should take? A. Discontinue the antibiotics and start a different class of oral antibiotics. B. Perform a culture and sensitivity test to identify the specific pathogen and adjust the treatment plan accordingly. C. Increase the dose of the current antibiotic and monitor the inmate for improvement. D. Switch to topical antibiotics and recommend increased wound care. Answer. B. Perform a culture and sensitivity test to identify the specific pathogen and adjust the treatment plan accordingly. Explanation. When an infection does not respond to initial antibiotic treatment, performing a culture and sensitivity test is crucial to identify the specific pathogen and its antibiotic resistance profile. This information will guide the selection of an appropriate antibiotic. Simply switching antibiotics without increasing the dose without knowing the resistance pattern could lead to ineffective treatment and further complications. Topical antibiotics may be useful for superficial infections but are not appropriate for deep or resistant infections that require systemic treatment. Question 24. A correctional healthcare provider is caring for an inmate who has recently undergone surgery for a fractured femur. The inmate reports increasing pain despite being on a prescribed opioid regimen. What is the most appropriate response to manage the inmate's pain? A. Increase the opioid dosage and continue monitoring the inmate's pain. B. Assess for potential complications, such as infection or improper healing, and consider adjusting the pain management regimen to include non-opioid medications and alternative therapies. C. Recommend that the inmate tolerate the pain as it is normal during the healing process. D. Discontinue the opioids entirely and recommend over-the-counter pain relievers. Answer. B. Assess for potential complications such as infection or improper healing and consider adjusting the pain management regimen to include non-opioid medications and alternative therapies. Explanation. When an inmate reports increasing pain despite being on an opioid regimen, it is important to first assess for any complications related to the surgery such as infection or improper healing that could be causing the pain. Complications are ruled out or addressed. Pain management may need to be adjusted. This could involve incorporating non-opioid medications, e.g., NSAIDs, acetaminophen, and alternative therapies, e.g., physical therapy, heat-cold treatments to help manage pain while minimizing the risks of opioid overuse or dependency. Question 25. An inmate with a known history of asthma presents to the healthcare unit with shortness of breath, wheezing, and increased cough. The inmate has not been compliant with their prescribed inhaler therapy. What should the healthcare provider do first? A. Administer a short-acting beta-agonist, SABA, to relieve the symptoms and assess the inmate's response. B. Recommend that the inmate start using their inhaler regularly and send them back to their cell. C. Increase the dose of their daily asthma medication and monitor the inmate for improvement. D. Advise the inmate to use nebulizer treatment and continue monitoring without further intervention. Answer A. Administer short-acting beta-agonist, SABA, to relieve the symptoms and assess the inmate's response. Explanation. For an acute asthma exacerbation, the first step is to administer short-acting beta-agonist, SABA, to relieve symptoms such as shortness of breath and wheezing. The healthcare provider should closely monitor the inmate's response to the medication. If the symptoms improve, the healthcare provider can then assess the need for further treatment. Adjustments to the inmate's ongoing asthma management plan, including ensuring regular use of their inhaler. It is not sufficient to increase the dose of daily medication or recommend nebulizer treatment without first addressing the immediate exacerbation. Question 26. A correctional healthcare provider is caring for an inmate with diabetes who is non-compliant with their prescribed medication regimen. The inmate presents with symptoms of hypoglycemia, including shaking, confusion, and sweating. What is the best immediate response? A. Administer a dose of insulin to correct the low blood sugar levels. B. Provide the inmate with a source of fast-acting carbohydrate. C. Glucose tablets or juice and monitor their response. C. Wait for the inmate to recover on their own as the symptoms will resolve without intervention. D. Call for an ambulance and have the inmate transferred to a hospital for treatment. Answer. B. Provide the inmate with a source of fast-acting carbohydrate. C. Glucose tablets or juice and monitor their response. Explanation. In cases of hypoglycemia, the immediate treatment is to provide the inmate with a source of fast-acting carbohydrates such as glucose tablets or juice to raise their blood sugar levels. The inmate should then be monitored closely to ensure that their symptoms resolve. Administering insulin is appropriate in the case of hypoglycemia, as it would further lower the blood sugar. Waiting for the symptoms to resolve on their own or transferring the inmate to the hospital without first addressing the hypoglycemia is not a responsible course of action. Question 27. An inmate presents to the healthcare unit with sudden onset, severe chest pain radiating to the left arm, shortness of breath, and sweating. The healthcare provider suspects the inmate is experiencing a myocardial infarction, heart attack. What is the first step in managing this emergency? A. Administer aspirin to reduce blood clotting and call for emergency medical assistance for transfer to the hospital. B. Wait for the inmate to calm down and monitor their symptoms before taking further action. C. Administer pain medications to manage the inmate's chest pain without calling for emergency assistance. D. Send the inmate back to their cell to rest, as the symptoms are likely anxiety-related and not related to a heart attack. Answer. A. Administer aspirin to reduce blood clotting and call for emergency medical assistance for transfer to the hospital. Explanation. The symptoms presented are consistent with a myocardial infarction, which is a medical emergency. The healthcare provider should immediately administer aspirin if not contraindicated to help reduce blood clotting and call for emergency medical assistance to transfer the inmate to a hospital. Prompt treatment. Critical in minimizing heart damage. Waiting for the inmate to calm down or simply administering pain medications without addressing the potential heart attack could result in life-threatening consequences. Question 28. A correctional healthcare provider is managing an inmate with a history of bipolar disorder. The inmate has been prescribed mood stabilizers, but recently the inmate has exhibited signs of increased agitation, rapid speech, and impulsive behavior. What should the healthcare provider do first? A. Increase the dose of the mood stabilizer and observe the inmate for any further symptoms. B. Assess the inmate for signs of manic or hypomanic episodes and consider adjusting the treatment plan, potentially adding an antipsychotic or mood stabilizer. C. Recommend that the inmate participate in individual therapy and observe the inmate's behavior for a few weeks before making changes to their medication regimen. D. Discontinue the mood stabilizer and switch to an antidepressant to address the symptoms. Answer. B. Assess the inmate for signs of manic or hypomanic episodes and consider adjusting the treatment plan, potentially adding an antipsychotic or mood stabilizer. Explanation. Signs of increased agitation, rapid speech, and impulsivity could indicate a manic or hypomanic episode in a patient with bipolar disorder. The healthcare provider should assess the inmate thoroughly to confirm the diagnosis and then adjust the treatment plan as necessary. It may involve adding or increasing the dosage of mood stabilizers or adding an antipsychotic medication to help manage the episode. Simply increasing the dose of the current medication without a thorough assessment or switching medications without a clear indication would not be the best approach. Question 29. An inmate with a history of schizophrenia presents with a sudden onset of fever, muscle rigidity, and altered mental status. The healthcare provider suspects neuroleptic malignant syndrome, NMS, due to antipsychotic medication. What is the first step in management? A. Discontinue the antipsychotic medication immediately and provide supportive care, including hydration and cooling measures. B. Administer an antipyretic to reduce fever and monitor for improvement. C. Increase the dose of the current antipsychotic medication to address the symptoms. D. Administer benzodiazepines to control muscle rigidity and prevent further complications. Answer A. Discontinue the antipsychotic medication immediately and provide supportive care, including hydration and cooling measures. Explanation. Neuroleptic malignant syndrome, NMS, is a potentially life-threatening condition that can occur due to the use of antipsychotic medications. The first step in managing an MS is to immediately discontinue the antipsychotic medication. Supportive care should be provided, including hydration and cooling measures. Manage fever and prevent complications. Administering antipyretics or benzodiazepines may provide temporary symptom relief but does not address the root cause, which is the medication. Increasing the dose of the antipsychotic medication is contraindicated in this scenario. Question 30. A correctional healthcare provider is managing a patient with a history of alcohol use disorder who is admitted with symptoms of delirium tremens (DTS). The patient is experiencing confusion, agitation, and tremors. What is the most appropriate initial treatment for this condition? A. Administer high-dose benzodiazepines to prevent seizures and manage agitation. B. Provide fluids and electrolyte replacement therapy, as DTS are typically self-limiting. C. Administer opioids to manage the withdrawal symptoms and reduce discomfort. D. Increase the patient's alcohol intake gradually to prevent severe withdrawal. Answer A. Administer high-dose benzodiazepines to prevent seizures and manage agitation. Explanation: delirium tremens (DTS) a severe form of alcohol withdrawal that requires immediate medical intervention. The most appropriate initial treatment is the administration of high-dose benzodiazepines, such as diazepam or lorazepam, to prevent seizures and manage agitation. Benzodiazepines help reduce the risk of life-threatening complications associated with DTS. Fluid and electrolyte replacement therapy may also be necessary, but benzodiazepines are the primary treatment for managing DTS. Opioids or increasing alcohol intake are not appropriate treatments for alcohol withdrawal and can worsen symptoms.